So much, sir, for your words of wisdom and motivation. I would now like to request our chief guest for today's function to inaugurate the virtual OTICON.
So, with Dr. Marilyn's speech, the scientific program starts. I welcome Dr. Marilyn for providing the keynote address of the conference on the theme of opportunities for occupational therapy service in a new normal. And Dr. Marilyn is the General Manager and Director of MPOD as Access Fitness, a leading service provider for adult community rehabilitation services in South Australia. And she is the immediate past president of World Federation of Occupational Therapists. She has done her master's in business administration. She has been awarded the OT Australia National Award for her contribution to her professional association, as well as the Sylvia Doctor Lectureship for her contribution to the profession of occupational therapy. She is an honorary member of the Swedish Occupational Therapy Association and the Moroccan Association of Occupational Therapy. She is also the honorary fellow of WFOT, the highest international honor an occupational therapist can receive. But welcome, madam. Please, it's the stage is yours for keynote address.
Okay, thank you all very much. I'll just share my screen and then we can start. Okay. So, distinguished guests, colleagues and friends, I would like to congratulate the All India Occupational Therapy Association and the Congress organising team on organising this the first virtual Congress. And I would like to say what a smooth process it has been. I'm sure it hasn't felt like a smooth process for you. And I also want to say a special congratulations to the COVID warriors. Today's presentation will address the challenges faced by occupational therapists globally in the response to COVID-19. But I also want to talk about occupational therapists.
Ma'am, sorry to interrupt you. Please share your screen, please.
Sorry?
Share your presentation, please.
Oh, I thought I was. Hang on. Sorry. I shared my screen.
Yeah, ma'am. Make it slideshow.
Is that it?
Yeah.
Can you see it?
Yeah. Thank you.
Okay. But you could hear me?
Yes, ma'am.
Yes, okay. So today's presentation will address the challenges faced by occupational therapists globally in response to COVID-19. We'll also talk about occupational therapists as leaders of progress, social entrepreneurs, and as agents of social change. As experts in holistic rehabilitation, occupational therapists have a vital role to play in addressing the debilitating effects of COVID-19 by offering a personalised and occupation-focused approach to care. They support the recovery of people experiencing functional challenges arising from the virus and its treatment. So I would like to share with you now WFOT's response to the COVID-19 pandemic. So when the pandemic first struck, WFOT was inundated with requests for information and resources. Many of them were asking, what could occupational therapists do? So WFOT immediately issued a statement on the occupational therapy response to the COVID-19 pandemic. So as a profession, we recognise the consequences and changes that are occurring in how people access and undertake their occupations as a result of the COVID-19 pandemic. And these include, but are not limited to, accessing resources, activities of daily living, communication, mobility, social isolation, mental health, and well-being. As people began the journey to recovery, the vital role that occupational therapists could play became evident, and a second statement was issued on occupational therapy and rehabilitation of people affected by the COVID-19 pandemic. And so WFOT acknowledged that many people do not have access to occupational therapy, and we advocated for equal opportunities to rehabilitation for people affected by COVID-19 as a human right. At the same time, educators and students had multiple queries around fieldwork and how could they continue to meet the minimum standards. So a statement was also issued addressing the WFOT minimum standards for the education of occupational therapists as it related to the COVID-19 pandemic. And WFOT reiterated that a dynamic and flexible approach to how the 1,000 hours is achieved has always been the intention of the minimum standards. And the COVID-19 pandemic required occupational therapists to develop new and innovative mechanisms for the delivery of services, and through this has reinforced the need to identify and adapt learning opportunities. Excuse me. The following WFOT resources were also identified as supporting the occupational therapy response and educating the general population on occupational therapy's vital role. And these include, as you can see in the list, position statements and endorsed publications. We also answered queries about how could practitioners, how could educators communicate with each other. And so through the Occupational Therapy International Online Network, we were able to establish two separate forums. One was the interactive online forum for practitioners to engage with others and share ideas on practice initiatives and support. The second one was the interactive online forum for educators to share ideas about practice placements and student support. We received many global resources from our member organisations around the world. And these have all been positioned in a centralised repository of global resources, which are freely available on the WFOT website. We also engaged with the World Health Organization through submission of statements, participation in briefings, and dissemination of information. We made statements at the 73rd World Health Assembly in May 2020, the 70th session of the World Health Organization Regional Committee for Europe in September 2020, and statements at the 71st session of the World Health Organization Regional Office for the Western Pacific in October 2020. And we also provided free access to online learning modules, in particular the WFOT Disaster Management module, and I would like to acknowledge Dr. Kit Sinclair, who's with us today, who drove that project. Also the WFOT Quality Evaluation Strategy tool, and soon to be released the Human Displacement online learning module. And following on from the global survey, which I'm going to talk about, the following articles have now been published and are again freely available on the WFOT website. So the first one was the data set, the global survey report, which showed the impact of COVID-19 for occupational therapy. And this is what I'm going to be speaking about by and large today. And that was released in November 2020. There was a journal article, The Impact of COVID-19 for Occupational Therapy, Findings and Recommendations of a Global Survey in November 2020. And a second journal article, Occupational Therapy, Telehealth and COVID-19 in November 2020. So the most substantial piece of work that WFOT undertook was a global needs assessment survey. And it was undertaken by WFOT to obtain input regarding how the COVID-19 pandemic affected the quality and delivery of services in occupational therapy education, research and practice, and the needs of the occupational therapy community for future resources and support. Quest is a tool developed by WFOT to provide a systematic approach for the evaluation of the quality of occupational therapy. As the survey addressed the impact of COVID-19 for the quality and delivery of occupational therapy, Quest served as an appropriate framework to analyse and group collected data. And this quality evaluation and strategy tool is also freely available on the WFOT website. It's designed for use in all areas of occupational therapy, regardless of the setting, the types of services provided and the population served. And it addresses 7 dimensions of quality, including accessibility, sustainability, efficiency, appropriateness, effectiveness, person-centeredness, and safety. So the methodology was an online survey involved in occupational therapy, practice research and education in countries around the world. It was conducted between April and July 2020. The survey was circulated online through the WFOT website, WFOT member organisations, social media and the WFOT e-newsletter, and was made available in different languages. We had 2,750 respondents globally, and the majority of respondents lived in high-income countries, and most completed the survey in English or in Spanish. The majority were practitioners, 67%, or educators and researchers, 33%. And respondents most frequently worked in a facility, such as a hospital, a rehabilitation centre, or a nursing home. And this shows the location of the respondents, a very busy slide. However, the column highlighted in yellow shows that we did receive 80 responses from India. And I congratulate those therapists who were willing and able to participate in the survey. As we said, most respondents were practitioners, secondly educators, and then managers, with a very pleasing response from students. And we did analyse the sub-themes from the student response, which I'll also talk about. This just shows the practice settings, and as we said earlier, the majority were either in inpatient services, hospitals, rehabilitation centres, or individual homes and home care services. So in terms of accessibility to services, most often the funding for the services provided by respondents was public, 42%, or a mixture of public and private, 30%. At the height of the COVID-19 pandemic, half of the respondents experienced a full lockdown, so all non-essential services were closed, with an additional 30% experiencing many restrictions, and only 1% experienced no restrictions at all. Interestingly, not all, some countries thought occupational therapy was an essential service. In some countries, it was deemed not to be an essential service. And at the time of the survey completion, 20% of respondents were under full lockdown, and I think 40+% experienced many restrictions. Access to occupational therapy at the height of the pandemic was very challenging. 77% of respondents indicated that their usual service population faced many restrictions or a full lockdown of occupational therapy. 85% of respondents experienced some or complete changes in their service population, for example, as a result of redeployment. If we move on to sustainability, respondents stated that telephones and the internet were the most easily accessible additional resources needed during the pandemic, while the hardest resource to obtain was additional space for social distancing and facilities. Telehealth was used by approximately half of the respondents, and for 70% of these respondents, policy changes were needed in order to implement the telehealth practices, which of course led to delay in implementation. So issues on implementing telehealth most frequently related to funding, slow internal processes, consent requirements for the service population, and data protection concerns. And I know in my own practice, we spent a significant amount of time making sure that we had secure platforms through which to deliver telehealth services. With regards to efficiency, 2/3 of the respondents reported feeling highly or mostly unprepared to work in a pandemic prior to COVID-19, and only 5% reported feeling highly prepared. The vast majority of respondents rated COVID-19 as having a high impact on their work, and less than 1 in 6% reported a no or low impact, respectively. In terms of appropriateness, 54% of respondents working during the COVID-19 pandemic rated their competence as high or very high. 9% considered their competence low. On average, respondents were sometimes to usually confident in their use of additional resources that were required as a result of the COVID-19 pandemic. And respondents had the highest confidence in using computer hardware and the lowest confidence in using guidelines, evidence, and protocols. So the Global Needs Assessment Survey results were that 56% of respondents received COVID-19 specific training. These respondents were more likely to report higher competence, less likely to report that the pandemic had a high impact on work, more likely to find employers' expectations were reasonable, more likely to find the pandemic improved work morale, and more likely to report higher safety at work. So this shows the importance of the appropriate training being provided. And again, I am very aware that the All India Occupational Therapy Association released some online learning modules, which at WFOT we had the opportunity to review. And I congratulate the association on this important initiative during the pandemic. In terms of effectiveness of services, 42% of respondents rated their effectiveness in meeting the immediate needs of their population as medium. Only 38% of respondents rated their effectiveness as high or very high. And similarly, 40% of respondents regarded the impact of their service provision in meeting the long-term needs of their service population as medium, and only 36% as high. Of the respondents that employed telehealth practices, 32% indicated that they used outcome measures to evaluate their services, and this is very important. If we look at person-centeredness, expectations of the employer were rated as usually or always reasonable by 69% of respondents, but a very small percentage, 3%, reported that their employer's expectations were never reasonable. And the COVID-19 pandemic had a variable impact for work morale. Respondents most frequently described the impact as negative, but 32% felt that the impact was somewhat positive. And in the commentary around the survey results, we heard some therapists who had to provide their own PPE, personal protective equipment, and some therapists who were not even allowed to use it, even if they did provide their own PPE. There was also quite a lot of feedback regarding managing the mental health, not only of our clients and patients, but also of the therapists themselves. In terms of safety, the majority of respondents reported feeling usually or always safe while providing occupational therapy services. 7% reported never feeling safe. And almost all respondents reported that working during the pandemic impacted their health, most frequently with a medium level of impact. And this is both physical and psychological impacts. And 27% rated the impact of working during the COVID-19 pandemic as high. So there were a lot of recommendations that came out of the survey, and I'd just like to summarise the key ones. So the recommendations for the workplace regarding preparedness for a pandemic situation, of more than 1,500 comments, there were 7 main themes which emerged, and from the thematic analysis encompassing 32 sub-themes. And these are the top 7. And they were for the workplace to promote safety, to ensure availability of the required resources, to facilitate alternate work methods, to provide leadership and to ensure preparedness, to support occupational therapy education, and to ensure funding. The recommendations for occupational therapy organisations regarding preparedness for a pandemic situation, again, of almost 1,400 comments, 7 main themes emerged, encompassing 38 sub-themes. And this was for occupational therapy organisations to provide information and resources, to advocate for occupational therapy and occupational justice, to support alternate work methods, to develop standards and guidelines, to facilitate research and dissemination, and to promote interorganisational collaboration, as well as to support occupational therapy education. And as I said earlier, there were 300 students who also completed the questionnaire. And so these contain recommendations for education regarding preparedness for a pandemic situation. And so the recommendations were to ensure the availability of student placements, to include disaster management and pandemic scenarios in curriculum, and to facilitate continuity in education, for example, virtual teaching and teaching online. And in the inaugural ceremony, many of these themes have been touched on, and in particular around telehealth and online education. One academic in Australia actually said to me that they had been trying to get some modules of their education online for 10 years, but were told it was too difficult until the pandemic struck, and they were able to move the whole occupational therapy education program online in 10 days. So it could be done. And so these are some of the themes or issues and trends that emerged from this survey. And the first one, and I think probably one of the most important ones, is the increasing role for occupational therapy services across intensive care, post-acute care, rehabilitation, and mental health. And, you know, in all of these areas, there is a strong role for us as occupational therapists in screening and assessment, in goal setting, in prevention and management of physical disabilities, in occupational engagement, in psychological interventions, and in discharge planning and onward referrals where necessary. But in order to do this, we need some of the other issues that evolved were the need for access to resources. And this included personal protective equipment, infection control protocols, additional space for social distancing, workplace support and flexibility, and technology. And for telehealth, which emerged as a major issue, we need to have provider and user access to technology. We need service protocols, funding and reimbursement strategies, and an acceptance by service users. The issues and trends emerging from education were to transition to online learning, that we needed to think about new approaches to fieldwork education and placements, and emergency preparedness needed to be included as part of the curriculum. In terms of professional resources, we need evidence-based or evidence-informed information, practice guidelines, and greater opportunities for information exchange. And finally, there are issues around advocacy, awareness of occupational therapy, and occupational justice. So I'd like to now move on to occupational therapists as leaders of progress, social entrepreneurs, and agents of social change. The aim of my presentation was to talk about opportunities within the new normal, and I believe that there are limitless opportunities in all of these three areas for us as occupational therapists. John Maxwell tells us that a leader is one who knows the way, goes the way, and shows the way. And we heard in the inauguration ceremony how occupational therapists in India had done this in so many, many ways. And I think it was very strongly acknowledged. Many of you may have heard me speak in the past about entrepreneurship and the essence of my interpretation of entrepreneurship, which is a vision of empowerment for occupational therapists. As occupational therapists, we need to develop the capacity and the power to construct our own destiny. For some of this might not be a very comfortable journey, and yet our whole careers are focused on enabling and assisting people to meet their maximum potential. So how can we effectively work with others if we have undercapitalized on our own potential? Occupational therapists need to be prepared to be the leaders of progress at an individual, group, and societal level. In 1989, Elnora Guilfoyle stated that performance as an occupational therapist epitomizes the concepts of transformational leadership. The basic values and philosophies inherent in occupational therapy are the same as those in transformative leadership. Both occupational therapists and transformative leaders facilitate changes in behaviours, build confidence, and empower others. It is a small step to then convert followers into leaders and leaders into agents of change. She explained that leadership, like occupational therapy, is an ongoing process of learning about others. Furthermore, Griffiths and Schmelzer in 2015 indicated that occupational therapy has already made the transformation to holistic healthcare, which puts occupational therapists in a prime position to lead modern healthcare in its current transformation from the traditional medical model into a more holistic biopsychosocial model of patient or client care. We can all be leaders in whatever role we play. We need to challenge our thinking, our constructs, and our spheres of influence. Being included in the society in which one lives is vital to the material, psychosocial, and political aspects of empowerment that underpin social well-being and equitable health. It is important that we talk about meaningful change and think in solutions. In the midst of a real crisis, leaders step up, put their case and act, and typically others follow. So real leaders do exist, and in her presidential address, the then American Occupational Therapy Association president, Dr. Florence Clark, stated, "More than any other health or wellness profession, we, occupational therapists, understand that hope still glimmers in the darkest hour. That's because we are witnesses to and champions of the fundamental power of daily occupation." As a leader, for today, I've just put together what I believe are some general characteristics of leadership. And the first one is communication. As a leader, you need to be able to clearly and succinctly explain everything, from our overarching goals to specific tasks. Communication needs to be clear, both verbal and written, and an intrinsic part of the communication is listening in an open and positive way, not planning your response at the same time. And of course, communication is essentially the topic of a whole other presentation, but I'm sure you get what I'm aiming at. Motivation. Leaders need to inspire people to go the extra mile because this is what creates passion. A positive attitude can go a long way, and you need to be able to laugh at yourself when something doesn't go quite as planned. It's really important that even in the most dire situations that we never lose our sense of humor. Creativity means you need to be able to think outside of the box. Learning to try non-traditional solutions or approaching problems in non-traditional ways will help you to solve an otherwise unsolvable problem. In one job I worked with, my clients used to call me the try another way lady, because if something didn't work, I would simply say, try another way. And the pandemic response by the occupational therapists in India, in my opinion, has demonstrated the high levels of creativity and preparedness to try another way that exist among every single one of you. Flexibility. Mishaps and last-minute changes always occur, and flexibility helps us to roll with the punches. If we take sudden changes in our stride, then that's what allows our creativity to kick in. We also need to be open to suggestions and feedback, using our communication skills to listen openly. And as you can start to see, all of these characteristics are interrelated. Responsibility. We need to be responsible for both the successes and the failures of the individuals we work with. And we need to be willing to accept the responsibility when something doesn't go quite right. Nothing beats a heartfelt apology, which goes a very long way to resolving a difficult situation. And remember, when you point your finger at somebody else, there are 3 fingers pointing back at you. Decisiveness. Effective leadership involves the ability to make decisions quickly with the information that you have. I believe that no action is worse than a bad decision. If we stop things from moving and bottleneck, then projects go nowhere. Integrity is often seen as just truthfulness or honesty, but in many cases, it also means having and standing by a set of strong values. Integrity means being able to make ethical choices, not based on vested interests or preconceived ideas. Relationship building, including team building. So leadership requires the ability to build and maintain a strong and collaborative team of individuals working toward the same goal. Team building requires other leadership strengths like effective communication skills and conflict resolution. Effective problem solving requires staying calm and identifying a step-by-step solution. Problem solving skills can lead to quick decisions and overcome obstacles. And being dependable means that people can trust and rely on you. A dependable person follows through on plans and keeps promises, enabling working through difficulties that may arise. And finally, the ability to teach and mentor. One of the skills that differentiates leadership from many other competencies is the ability to teach and mentor. This requires us to think less about ourselves and more about what we need to do to make our team as a whole successful. And how many of you have one or more of these qualities? Of course, we all do. Occupational therapists' increasing involvement in community-based rehabilitation, disaster preparedness and response, and primary health, among the other emerging areas of practice, is based on the concept of social entrepreneurship. Working directly with communities on projects that are meaningful to each community, having influence on local and higher health and policymakers, and working with non-government organisations all position occupational therapists as having a unique contribution to the goals of a civil society. Occupational therapists need to understand the vital role they play in what makes populations healthy. WHO told us in 2008 that social injustice is killing people on a grand scale. Achieving health equity within a generation is achievable. It is the right thing to do, and now is the right time to do it. And what I put to you is occupational therapists are the right people to be involved. COVID-19 has disproportionately affected the poor minorities and a broad range of vulnerable populations due to its inequitable spread in areas of dense population and limited mitigation capacity due to the high prevalence of chronic conditions or poor access to high quality public health care and medical care. Moreover, the collateral effects of the pandemic due to the global economic downturn, social isolation and movement restriction measures are unequally affecting those in the lowest power strata of societies. Vulnerable populations can include older adults, which have already been mentioned earlier today, people living in densely populated areas, people with lower socioeconomic status, migrants and minorities. And vulnerable populations also have much higher rates of comorbid chronic conditions. People holding essential roles, usually from lower paying jobs, such as public transport operators, retail workers, or some healthcare workers, are more exposed to the public, increasing the risk of infection. Minorities and migrant populations also face language and cultural barriers. And people with poor access to healthcare who experience COVID-19 related symptoms may delay or even forego being treated or tested. And the current COVID-19 death toll fails to capture the devastating collateral effects on health equity, including loss of health insurance, loss of jobs, loss of homes. Social isolation and movement restriction jeopardize health and access to basic needs. What business entrepreneurs are to the economy, social entrepreneurs are to social change. They are the driven, creative individuals who question the status quo, exploit new opportunities, and completely refuse to give up. They want to remake the world for the better. WFOT, through its position papers and publications, human rights, community-based rehabilitation, cultural diversity, and the WFOT minimum standards for the education of occupational therapists, supports this social contract. And this highlights the need for the changing focus in education and research, and mirrors the evolution of the WFOT minimum standards for the education of occupational therapists. The original standards in 1958 prescribed course requirements and the outline of a programme in terms of basic sciences, theory and application, and fieldwork. And the most recent review in 2016, building upon the 2002 version, moved from a prescriptive to a non-prescriptive approach. And it emphasises human rights advocacy as a core principle, essential skills, knowledge and attitudes for competent practice, human resources, supply and demand, application of occupational therapy models in the social sector, and ethics. Change has a considerable psychological impact on the human mind. To the fearful, it is threatening because it means that things may get worse. To the hopeful, it is encouraging because things may get better. To the confident, it is inspiring because the challenge exists to make things better. As occupational therapists, we must take our role as agents of social change seriously. Never before in the history of our profession have we had the opportunity to take centre stage and truly impact on the health and well-being of all people. Moving forward, WFOT has identified clear actions for itself as the global professional representative, supported by its member organisations, which India is one. So we need to advocate to address occupational injustice that increases the vulnerability of people to the effects of the COVID-19 pandemic. We need to advocate for access to occupational therapy to facilitate full participation and inclusion of people in society as a human right. We need to develop collaborative initiatives to provide information and supports needed for occupational therapy during and following the COVID-19 pandemic. And we need to develop standards and support that promote quality in the profession, in the provision of occupational therapy practice, research and education. So before I close, I would like to talk to you all very briefly about the next WFOT Congress 2022, which is to be held in Paris, France. The Congress theme, Occupational Revolution, highlights the leadership of occupational therapy for navigating the dynamics of change. As some of you may already be aware, this conference is now going to be a hybrid conference. So there will be the opportunity for us not to have to travel halfway around the world, but rather, as with this OTICON 21 conference, the ability to join online. So I ask you all to join me in the occupational revolution. As occupational therapists, we are international professional citizens. As the world is now our backyard, the knowledge, skills and attitudes of the occupational therapy profession are coloured and shaped by diverse transcultural exposure, a oneness with humanity and fairness. Interconnectedness with the world promotes a desire to make decisions that will create a better place through engagement in occupations. The challenge for us all is to continue to promote occupational therapy within a wide range of differing social and cultural contexts and to make the changes that matter. I would like to say a big thank you for inviting me to speak today. I hope that my contribution will give you much food for thought, and I wish you an exciting, interesting and educational OTICON 21. And I'm sorry that I can't join you for the whole conference. Thank you.
Thank you, Dr. Marilyn. Yes, of course, we value your time. You won't be able to join the full time, and the timing also may not show. And I thank you for thank you very much for highlighting the challenges faced by all the occupational therapists.
Thank you. It was a pleasure.
Occupational therapists during the pandemic and the WFOT initiatives over the last 1 year. And special thanks for acknowledging our AIOTA's efforts during your speech. Thank you very much, madam.
Thank you. My pleasure.
Thank you.